Are root canals good, bad, or hell no? Let's get into it. Have you been told that you need a root canal, or do you have an existing root canal in your mouth? I know there is a lot of information floating around on the internet, and some of it is true and a lot of it is not based in fact. So let's break this down. What is a root canal treatment? Basically, when a tooth is injured, the nerve and the blood vessels that reside inside the tooth die, which can then lead to an infection. So what is done during the root canal procedure is that material is removed, the area is cleaned, and then that part of the tooth is sealed. And what some dental influencers who claim to be more biologic and holistic claim on the internet is that root canal teeth are a dead body part that are left behind. And as such, a dead body part can cause all kinds of issues. Now, let me just break this down. Even though the inside part of the tooth where the nerve and the blood vessel is removed, this doesn't make the tooth a dead body part because the tooth also has the outer portion that's called the root. And roots of teeth are basically suspended in the jawbone by live ligaments. These are not dead body parts, by blood vessels that attach to the outside of the root. This is not a dead body part. And more importantly, the covering of the root is something called cementum, which is very similar to bone. And cementum has live cells in it called cementocytes. This whole idea that we're leaving behind a dead body part makes absolutely no sense. It's not based in fact or science, and it's just a way of scaring people. The second thing that they argue is that root canals can be a source of infection, meaning that because it's a dead body part, there will always be inflammation and infection around root canal teeth, which can then affect the rest of the body. And some people even claim that this can cause cancer, or it interferes with your chakras and your meridians and can cause issues with your other body organs. The idea that root canals are bad was really disseminated by a dentist who was practicing in the 1920s, Dr. Weston Price. He did some experiments on rabbits. Now, keep in mind, these experiments were done in the 1920s, so he didn't have the same controls, the same methods that we have today. And based on his observations, he felt that root canal teeth ended up getting infected and then caused issues. Now, this may have been true in the 1920s and with rabbits, but all of these ideas have been completely debunked over time. A properly done root canal tooth does not cause inflammation and does not get infected or does not give you cancer or affect your chakras or your meridians. Root canals are about 90% effective. What does this mean? It means that about 10% of the time, we don't get the results that we want. And why is that? Because a tooth that needs a root canal has something wrong with it to begin with. So it was either injured through an accident, it has probably a very big cavity, and that's why it ended up needing a root canal, or it somehow broke. Maybe you bit on a pit or something and you broke part of the tooth. So this tooth is already a weaker tooth to begin with. So even though the root canal is done and it's done properly, there's 10% of the time that the tooth structure is so weak that it ends up breaking. And sometimes these breaks are very small. It's a microscopic break that we can't see on an x-ray, but unfortunately, it does lead to the tooth being lost. But 90% of the time, these teeth survive and are very successful. And in medicine, anything that has more than an 85% chance of success is actually considered to be a very, very successful procedure. So root canals, when they're done properly, are actually quite successful. In order to have a successful root canal, several things need to be done. Number one is your dentist or your endodontist. So endodontists are root canal specialists who go through 3 years of additional training to learn how to do root canals properly. When they do this treatment, they're usually doing it under high magnification or with the use of a microscope, because the internal structure of teeth is very small, as you can imagine, and The microscope allows the endodontist or your dentist to do this procedure much more precisely and, quite frankly, in a much better way. Number one. Number two is root canal specialists always isolate the tooth, meaning they put a rubber dam around the tooth to keep the bacteria from the mouth from seeping inside the tooth while they're doing the root canal procedure. You see, we don't want any bacteria left inside the tooth because that can lead to an infection. So the isolation of the tooth is very critical during the process of the root canal. Lastly, they use very precise instrument and instrumentations to clean the inside of that tooth and to shape it so that they can put a sealant inside that seals that entire cavity so bacteria or anything else cannot get in. And when all of those things are done properly, the root canal has a very high chance of success. So if you've been told you need a root canal, what are your options? Well, the options are two. One, get the root canal done, or two, have the tooth extracted. And if you have the tooth extracted, then you have to replace it with a dental implant. Dental implants are amazing. They've revolutionized dentistry, and I'm an implant specialist. So the incentive for me would be to recommend to have the tooth taken out. But that's not what I tell my patients. I tell the patients is if we can save a tooth, that's the way to go, because an implant is still a prosthetic and it's not your natural body part. Natural body parts obviously will always work better than any prosthetic. The other thing is, if you get a root canal now and you buy yourself another 5, 10, 20 years with that tooth, we don't know what kind of options are going to be available to us in 10 years. All I know is that implants and everything else that we're doing is getting better and better over time. If we can delay implant placement by 5 or 10 years, that's absolutely the way to go. To wrap it all up, root canals save teeth. They do not cause other issues and they don't lead to other issues in the human body. And when done properly, are very successful. So in my book, root canals are good.